The Diabetes Center at Carroll Hospital Center helps more than 500 people each year manage their diabetes and enjoy healthier, more active lifestyles. Overseen by a board-certified endocrinologist, the Diabetes Center's staff consists of registered nurses and registered dietitians, all certified diabetes educators.
Before I was diagnosed with diabetes, I kind of ate what I wanted as much as I wanted. Didn't really understand what diabetes was, and that's how I got to the Diabetes Center here. I had no warning signs. It was a routine visit with my normal doctor, and what happened was in 2003 I was diagnosed with prostate cancer, and during the pre-op physical she said, "Your numbers are a little high, you might be pre-diabetic, but there's a little more to worry about. We'll decide this afterwards." And that's how it was diagnosed, basically through blood work at my personal physician.
When a patient comes to the center initially as a newly diagnosed person with diabetes, the physician refers them, they will come to the center, they will receive a 2-hour educational session. 1 hour is with the nurse, who usually talks about the physiology of diabetes, talks about the complications, helps establish goals with the patient as to why they're there, what they would like to accomplish, and then they move on to the dietitian, who talks to them about meal planning, their dietary habits, some things that the patients would like to change, their weight goals, and that sort of thing. And then when they come back a month later, it's either a nurse or a dietitian that they see, and thereafter.
The Diabetes Center helped me learn more about the diabetes itself and what complications could occur. I don't want to say it was a scare tactic, but it does get you thinking that the complications that can come from having diabetes not under control, like heart problems, circulatory problems, not to mention eyesight, kidneys. So it really gets you thinking, and they kind of tell you where they actually set you up with a kind of like a meal plan. This is how many carbs you can have for breakfast, for lunch, for dinner. And from there, you kind of work towards it. You come back, get refresher courses. I've had 2 of them since I've been here. And I even email the staff if I have questions. I send Susan, who's, I guess, the head of the Diabetes Center, every couple weeks I can download my, I'm on an insulin pump now, so I can download the information and send it to her, and she can tell me if I'm doing good, numbers are high, what to do. And it's, you know, even if I can't get here, I'm in contact with somebody.
Our Diabetes Center, we've received a lot of feedback from the community regarding how special our center is, because we follow the patient indefinitely. We tell them that when they come into the Diabetes Center, that we are their constant support system from now for as long as they want. And they know that 2 years from now they can call us with a question. I believe every single one of my staff is passionate about teaching, passionate about diabetes, passionate about controlling diabetes to prevent the long-term complications. And the patients sense this. And we've gotten feedback from participants in our program who've participated in other programs, saying that our program outshines the others simply because of the feeling of caring and support they get from the staff members.
Diabetes, as far as what I do on a daily basis, is, like I said, I monitor myself before I drive, before I go to work, after I'm ready to leave to come home from work. On weekends, I like to sail. It just means, you know, other than taking a compass and my charts, I take insulin and backup insulin in case something happens with my meter. I have a backup glucose meter, so if the one fails, I have another one to go back to. it kept me basically doing everything I wanted to do. It's just I have to take a little bit of time for myself to get ready to do like a weekend to go sailing.
Jim is an awesome person. From the start, when he came through the door, he was very eager to learn about his diabetes. He was a little distraught initially, which we see all the time, but he has a very special personality. He was extremely receptive to our ideas. He applied them. He is like our ideal poster child patient. He would come back after the 4-week period, proud to have us look at his numbers, see his progress. If he sort of did some backsliding, he would receive support and encouragement to get back up on the wagon again and try again for the next 4 weeks. But as we could see him transition from being distraught to rather comfortable with dealing with his diabetes, rather accepting of it, I think we've assisted him in coming to accept his disease process and make the best of it, which he has. And he's made remarkable progress, and he just glows now. We really have had a great time with Jim, and he even gave us little lighthouses, thanking us for guiding him because he's into photography. So we were deeply touched by that gesture, and it actually spurred us on to continue teaching and assisting patients with diabetes. So he was an inspiration to us. We were an inspiration to him.
After coming to the Diabetes Center, I feel like I've kept my lifestyle the way I want to. I feel better. I feel like I'm more in control, and just glad that I'm able to do the things that I like to do.